Hi, I'm Savannah Goodlett. I am a nurse practitioner student at Auburn University, and I have Chris Fisher and Veronica Godsey joining me today to talk about rural healthcare disparities and ways to improve them. I'll let both of them tell you what they do.
Hey, I'm Chris Fisher. I'm a ER nurse in a rural community in North Alabama.
I'm Veronica Godsey. I'm a physician at Children's of Alabama.
Unfortunately, Chris sees a lot of things being in rural Alabama, preventable pain, suffering, morbidity, and mortality. Chris, can you tell me about some of the things that you see, why you see them, and maybe give me an example?
We just don't all the time have the equipment or the staff to kind of handle things like we're supposed to. You're spending 24 hours in one day with 4 total nurses and one total doctor. We tend to have to make do the best we can. And when there's 45 to an hour minute drives to get somebody to where they have the personnel and the surgery centers and that sort of thing, we have a lot of people that, because of the environment they live in, their quality of life is lowered. Their morbidity is lowered, their mortality is lowered. It's just not a great situation for everybody involved.
Okay, and Veronica, can you think of things that you have seen recently getting patients to you? Do you think that their outcomes could have been better had they got to you faster?
I do, and I think Chris touched on the resources in general. So when we have patients that are transported to our hospital from outside the centers, especially the more rural ones, just the resources are so different, and I think that can really impact what is able to be done for patients. And we do the best that we can, and the outside places do the best that they can, and ultimately with the same goal of trying to help take care of the patient. Sometimes we're just limited by what we have.
Like I'm doing right now, ways that we can get the ball moving to close this gap is to involve all healthcare professionals, get nurses, nurse practitioners, physicians, and political involvement so that we can get some government funding and things like that to offer financial assistance and, charitable programs specifically to rural Americans with a focus on that. And also potentially broadening a nurse practitioner's scope of practice to where we don't necessarily need a collaborating physician, but there are, differing opinions on that, especially from a physician standpoint. I know that we tend to meet resistance when talking about that. However, there are several studies that show that there are better health outcomes in states that have broadened the scope of practice, such as Utah and Colorado, compared to states like Alabama and Mississippi. They are furthering that research to defend it, but if we could get the ball rolling to, on a national level, broaden the scope of practice, I think that would ultimately help health outcomes all the way around, but especially in rural America, because physicians, there's not less than 10% of physicians want to be in a rural area. Chris, what is your take on having nurse practitioners' role expanded?
We don't have a single one. We rarely ever see them. And a lot of times it's hard to get good doctors that are contracted. And so if we could really, any help we would take, and if it took great nurse practitioners, then we'd be more than happy to have them.
You think the nurse practitioners would help if the doctors are working 24-hour shifts, the nurse practitioners would help.
Yeah, we just get 1 or 2, even a couple of days a week, just to kind of during clinic days and those kind of things, and make a huge difference.
Okay. And Veronica, what's your take on it?
So for me, it's that there's so much training from a physician standpoint in terms of education to a specific area of medicine, such as emergency versus family practice versus pediatrics. I believe that I'd be in support of it. I just think that there needs to be some oversight in terms of what the credentialing process is and how each provider is able to make sure that they are trained appropriately before they go out on their own.
So we could say that nurse practitioners and residents fresh out of school are essentially the same. And then, whatever the nurse practitioner is wanting to specialize in, maybe do a fellowship to earn their individual licensure.
It's possibly,
Okay,
yeah.
something like that. Yeah. And then these are just some statistics. Insurance is a big key component in the gap. We definitely need some charitable funds or ways like a national program, such as maybe something similar to the student loan situation, where individuals who need health care can finance their care with a lower interest rate, because rural communities do tend to face lower socioeconomic status, more financial constraint, and this could potentially help, because I don't really foresee a way that you could provide healthcare for all. However, you could potentially better access to healthcare for all, and especially in those rural communities. Let's see. We've already discussed the barriers to healthcare, charitable foundations, and then these are the references where I got most of the statistics. So I think that is it. Thank you guys for coming so much, and I hope this video was beneficial. Did I stop it?
No, go ahead, stop. Okay.
Thank you. Sorry.